For optometry, I think there is potentially there's a challenge of deciding what he wants to be. The business model that has been driving the agenda hitherto has been focused on sale of optical appliances. And despite the GOS contract largely being focused on need for optical appliances, many optometrists do try to stretch their role outside of that, even though the NHS doesn't necessarily reflect that sort of financially. And I think that will be one of the challenges to say, well, is there a different model that optometry can work in? Potentially be more in terms of being the primary eye care professionals working alongside the other primary care team of GPs and dentists, etc., etc. But that requires a new form of working and a new funding arrangements.
I think the key challenge that lies ahead is that we have an ageing population with increased need in times of budgetary cuts. So people are going to have to do things in different ways. It's not going to be about just trying to do new things on top of what we're doing already. We have to really review the services that we provide and try and look at the pathways and with input from service users and from the voluntary sector, redesign those pathways so that they are more efficient and we can deal with more people more effectively.
As always, it comes down to money. Really, it's how can we look at different models. In Scotland, they've tried something slightly differently. I think there are issues with the Scottish model, but the ability for there to be a supplementary fee to allow optometrists to bring patients back, to follow up something, I think is an excellent idea. And we could do more of that in England, Wales and Northern Ireland as well. There are local enhanced services for glaucoma referral refinement, for example. You often follow up patients with ocular hypertension or post-cataract follow-up. These are the sort of things that optometrists have been trained to do and have the skills to do it and have the equipment to do it. The difficulty is it's changing the working pattern for them to do that.
As a commissioner looking in on the optometry sector, the biggest challenge is the contract. I just wish that we could have a contract similar to the one that optometrists have in Scotland, because that has allowed a huge amount of change and innovation to happen. So I'll be lobbying for that as much as I can.